Well, not all healthcare happens in hospitals. Many providers go into patients' homes on a regular basis, so safety precautions are very important in these. Joining us now is Laurie St. She's Vice President of Hartford HealthCare at Home. Laurie, welcome.
Thank you.
Tell us about the current situation for your patients who are part of Hartford HealthCare at Home, Laurie.
Well, our nurses and our therapists continue to see our patients throughout the pandemic. We would normally see the congestive heart failure, diabetes patients, and we did see them, the majority of our patients, but we saw COVID patients as well. Currently, we see the COVID numbers going down.
Have things returned to normal for your operations?
They are starting to return to normal as the hospitals are doing more elective surgery, as the physicians' offices are opening up. We are seeing more and more patients, and again, our COVID numbers have started to decline.
So tell us again, you've been providing care throughout the pandemic, still going into people's homes and giving them that much needed care?
Yes. Well, we did change a lot of our practice. Safety has always been our primary concern in home care, the safety of our clinicians and our patients. Now we do screenings of our clinicians every single day. We also screen our patients. We do telephone screens before we go in, and then we do a screen when we do go into their homes. So that is one change. We strictly adhere to the CDC guidelines. So if we suspect the patient is COVID positive, we do wear the proper PPE. So we have seen changes, but again, safety has always been our priority.
And I'd imagine patients might have been scared having someone come into their home that maybe was at other homes with other patients. Did you see some of that? Did you have to reassure some patients, or did your teams have to?
Oh, yes, absolutely. Some of our patients were concerned, but I think that having the nurses come in and the therapists come in to treat them, knowing that we would do everything we could to keep them safe and to keep them safely in their home. Most patients did allow us to come in during the pandemic.
And tell us some more about the safety measures for patients and employees that you've been using, or will they now become standard?
Well, yes. Right now, every all staff in Hartford HealthCare have daily temperature screenings and also COVID screenings. So if they are positive on either of those, they do not come to work. For our patients, again, we call before we go. When the clinician goes into the home, she stays 6 feet away for another screening. That way, if she needs to or he needs to wear protective equipment or PPE, then they can make that possible. So we've done everything that we could to protect both our staff and our patients.
And speaking of your staff, are you proud of them in these times? You think of the healthcare frontline workers in the hospitals and the COVID units, but your teams have been going into homes, you mentioned, with some COVID patients and just doing fantastic work.
Yeah, I'm so proud of our clinicians. I'm proud of all of our staff. The fact that they continued throughout this, keeping patients safely in their homes, I could not be more proud of them.
Oh, that's a great point. Safely at home, too. All right, Laurie, thank you so much for joining us. We really appreciate your time. Thank you very much.
Thank you.
All right.